purpose of this video is to cover the axial skeleton, specifically the bones of the skull, and we'll begin with the cranial bones, which are the bones that surround the brain and the cranial cavity. So the first of those is the frontal bone, which is your forehead, goes a little bit up onto the top of your head. It goes down to the ridge at the top of your eye sockets. An eye socket is referred to as the orbit. And there is just one frontal bone. So it's green on this colored skull model and not green, but in the same position on the other. Then behind the frontal bone is the parietal bone, and there are two parietal bones in the human body. There's one on the right side and one on the left side. And that's what the two in parentheses after the name of the bone in the lab guide refers to. There's only one frontal bone, whereas there are two parietal bones. They come up and meet in the middle. The word parietal means wall. So this is like the side wall of the skull, and if you were to remove it, you would see the brain from the side. Then the occipital bone, or occiput, is the back of the skull. And I'm going to take the skull cap off of these two models so that we can see more of them. Set those out of the way. You can see on this superior view that the occipital bone is covers quite a bit of space that's up against the back part of the brain, and the same position on the other model. And if I turn it around for an inferior view, looking up from the bottom of the skull, kind of turning it upside down, this is an inferior view. The occipital bone is quite a bit of the skull surrounding the hole where the brainstem connects to the spinal cord. So all of this is occipital bone, and there's only one occipital bone. The temporal bone is on the side and is where your ear attaches to the side of your head. This is all the purple colored bone on this particular model. If we look at a model that just shows half of the skull, it's quite a bit of the side of the skull is the temporal bone. And there's going to be one on the left and one on the right. Then we move into the skull, closer to the brain and parts of the skull that are a little bit trickier to view from the outside of the skull. So starting with this superior view looking down into the skull from the top, the sphenoid bone is a moth-shaped bone. I'll put this disarticulated sphenoid bone on top of or near where it is this yellow bone in the articulated skull, and then likewise I'll put this yellow colored version of the disarticulated sphenoid bone near the articulated skull that does not have color coding. Sphenoid means shaped like a moth or a butterfly, and this bone is very much shaped like a winged creature. And there's just one sphenoid bone in the body. It is posterior to the inside of the nose, so it sits just behind the nose. And if I look at the lateral view of the skull, it is this yellow bone that continues down through the zygomatic arch here and at the back of the mouth. And if I look in the orbits, I can also find some of the yellow at the back wall of the orbit. That is also part of the sphenoid bone. So in the same positions when the skull doesn't have coloring, but certainly easier to find all the parts of the bone using the colored version of the skull. Then the ethmoid bone is anterior to the sphenoid bone, and it makes up the core of your nose. So looking at this superior view again, the ethmoid bone is this dark maroon colored bone that's directly anterior to or closer to the face from the sphenoid bone. When I look in the orbits, I can see the sphenoid bone kind of in that core of the nose, on the inside medial surface of the orbit. And then if I look up the nose, I can also see the ethmoid bone making up the core of the nose inside there. So that's the ethmoid bone. And all of those bones are going to be up against the brain, especially visible when we look into the superior view of the skull.